A lot of you may have had an injury in your life at one point or another. I'm going to talk to you about a surgery option if you were ever to have a cartilage injury or a cartilage tear. ACI is one of the newest and most successful options for cartilage repair. ACI stands for autologous chondrocyte implantation, or ACI for short. There are three main points that I'm going to discuss with you today: what the surgery is, why you might have this surgery, and how the surgery is done. For my first point, what the surgery is. Surgery is a cartilage implantation, like said in the name. They take cartilage out of your knee, grow it in a dish in a lab, and they eventually put it back into your knee, and it is supposed to adhere to the bone and become new cartilage. A quote according to cartilage.org says, "Damage to joint cartilage or damage to both the cartilage and the underlying bone does not repair itself spontaneously and results in joint pain and poor function." If you were to hurt a joint, you will have pain in the joint, and eventually you will have a total knee replacement or total hip replacement, for example. And obviously those aren't very fun things to have. So this cartilage implantation is to help people so that they may slow the process of having a knee or hip replacement. Now that I have discussed what the surgery is, I will talk about why you perform this surgery. The reason that I had to perform this surgery was because in football I tore my cartilage making a cut. I just happened to tear the cartilage. For most people, they just eventually tear the cartilage in their knee or wherever it happens to be. And this surgery then goes in, repairs that cartilage, and basically allows them to have a new knee or new end of the knee, so you don't have to get a total knee surgery. According to the ISMOC website, the coating on bones and joints that allows them to glide cartilage on cartilage is much more slippery than ice on ice. So the cartilage in my knee is called articular cartilage. And this website is saying that it allows your bones to glide much easier than ice on ice. So if you were to lose some of that cartilage, obviously bone is not as slippery and will not let you slide, and therefore it allows less function when you use your knee or hip if you happen to have hip. For my third point, how the surgery is done. Well, for mine, they go in, and it's called a scope for short, and they take out some cartilage from a non-weight bearing portion of your knee. So this is so that you don't have the same issue in a new spot. Take it from a non-weight bearing point because it won't have to slide like so. Then they take that and they grow it in a dish for about 4 to 6 weeks, and they can hold it for up to 2 years. But after that point, then you have to redo the whole surgery. And I was uncertain about mine, so we waited about 8 weeks before we did mine. Anyway, you go back in, and they make a large incision right over the kneecap, right here. And they put the cells back into your knee, and they use a little patch and sew it on to hold the cells in place. And eventually these cells are supposed to adhere to the bone or connect to the bone like the other cartilage has done and become virtually a new knee or new cartilage in your knee. And according to SportsMD website, ACI has a slow recovery time of 12 to 18 months and is very expensive and has a 70 to 90% success rate. So this ACI surgery is not a for sure deal. The cartilage cells sometimes do not adhere to the bone, and they eventually just die off, and the surgery was then unsuccessful. So in order for this to happen, you have to go through a lot of rehab. And the first 6 weeks, 6 to 8 weeks, is non-weight bearing. So you're on crutches, and you're also in a knee mobilizer. So you sit down in a chair or couch, preferably laying down on your back, and this machine bends and straightens your knee, and that is to allow the cartilage cells to grow. And this procedure has helped many people, helped myself immensely, because I was told I was never going to play sports again, and luckily, God willing, I was able to. But it is helping many people to delay total knee surgeries or total hip surgeries or wherever they